If you suffer from chronic headaches, you know the exhausting loop. The tension creeps up your neck, the pressure builds behind your eyes, and you reach for the exact same bottle of pills you used last week, knowing the pain will inevitably return. We typically experience 4 distinct categories of head pain. This diagram shows the primary physiological zones: a tight band across the forehead and neck for tension, a one-sided throb for migraines, concentrated ocular pain for cluster headaches, and deep facial pressure for sinus issues. The standard response to any of these 4 zones is to take an over-the-counter painkiller like ibuprofen or acetaminophen. But these medications share a specific mechanical limitation. They act as chemical blankets. They intercept the pain signals traveling to your brain, masking the symptom while ignoring the physiological, environmental, or emotional trigger that actually caused your blood vessels to dilate in the first place. Relying exclusively on these rapid relief chemicals creates a new problem: rebound headaches. When the medication wears off, the unaddressed tension returns, often triggering a secondary headache caused by the withdrawal of the drug itself. Homeopathy attempts a different strategy. Instead of blocking a signal with a synthetic compound, it uses highly diluted substances to prompt an internal response, selecting a remedy that mirrors the specific nature of your pain. Breaking out of the pain cycle requires an adjustment in how you view your body. You have to stop treating the broad, generic label of a headache and start meticulously tracking the specific individual signals your body is sending. Homeopathy operates on the principle of like cures like. Because it works with your body rather than overriding it, success requires hyper-individualized symptom mapping. You are no longer treating a general diagnosis, but the unique way pain manifests in your system. This table breaks down the specific trade-off. Under conventional care, the input is low. You swallow a pill. The outcome is blanket relief in 30 minutes. But the trade-off is that it ignores your triggers and carries a rebound risk. Under homeopathic care, the required input is much higher. You must execute precise symptom matching. The outcome is targeted, holistic relief that actively resolves the underlying imbalance. But look at the trade-off. If you take a natural remedy that does not precisely match your specific symptom profile, it fails completely. It will do absolutely nothing. You cannot treat homeopathic remedies like different brands of aspirin. You can't just grab whatever is on the shelf and hope for the best. Long-term relief means trading the speed of rapid-acting analgesics for a rigorous, high-effort observation of your own physical and mental state. Before you even open a homeopathic remedy, you have to secure your physiological baseline. This means establishing a foundation, drinking roughly 8 glasses of plain water a day, eating regular meals with complex carbohydrates, and eliminating known chemical triggers like processed nitrates and excess caffeine. It also requires checking your mineral intake. Incorporating magnesium-rich foods like almonds, oats, and seeds directly prevents baseline muscle tension. The foundation protocol is strict, but it has a limit. It is highly effective at preventing baseline triggers, but it will not provide acute relief when a migraine actively strikes. When an active headache hits, you have to map it. This flowchart, the homeopathic symptom matrix, shows the decision-making framework required to match your specific pain to the right remedy. We start here, at onset type. We follow the first diagnostic path. If your headache features sudden, intense, rapid onset pain, accompanied by a hot, flushed face and sensitivity to light, the matrix points to belladonna. Belladonna delivers highly targeted relief for aggressive, sudden migraines, or headaches brought on by strong sunlight and heat. But the rule is strict. If your headache is actually a slow-building, dull ache, taking belladonna is useless. Enduring the pain long enough to accurately identify your specific onset pattern is uncomfortable, but it is the mandatory cost for a remedy like belladonna to work. Let's look at headaches altered by kinetic energy and physical movement. Back to the matrix. If your pain is sharp, splitting, and strictly worsens with any kind of motion, the path leads to Bryonia alba. Bryonia demands a behavioral trade-off. If you use it, you must commit to absolute rest, ideally lying perfectly still in a quiet, dark room. If you take Bryonia and then attempt to push through a busy workday, you completely negate the medicine. It only works in tandem with rest. Contrast that with a completely different profile. If your headache has a slow onset, feels like a heavy, tight band around your skull, and disrupts your vision, the matrix indicates gelsemium. Gelsemium targets headaches rooted in profound physical exhaustion, sore neck and shoulder muscles, or the deep systemic fatigue that accompanies a viral onset like the flu. Utilizing bryonia or gelsemium correctly forces you to listen to the physical limits of your body. You have to accept the demand for rest, rather than using medication to override those signals. Some headaches are triggered by entirely invisible factors, like severe psychological stress or digestive overload. This final branch of the matrix tracks these invisible triggers. If you experience blinding, hammering pain tied to intense emotional grief or severe dehydration, the profile points to Natra muriaticum. Natra muriaticum addresses the specific physiological burnout caused by suppressed emotional strain, lingering trauma, and severe sleep deprivation. The parallel path tracks a different kind of stress. If your headache features a bruised, heavy sensation combined with digestive issues, nausea, or constipation, the matrix lands on nux vomica. Nux vomica is indicated when you have simply pushed your system too far. It fits individuals experiencing aggressive burnout, extreme irritability, and overindulgence in heavy foods or exposure to toxins. To successfully use NatMur or Nux vomica, you have to subject your own mental health and daily diet to uncomfortable, objective analysis. It is a highly demanding psychological intervention. Let's evaluate the actual return on investment for adopting this system. You have to decide if the effort of homeopathy makes sense for your life. This chart maps the treatment spectrum. We are plotting the level of management required against the type of relief you get. Consider the holistic optimizer. They painstakingly track their triggers, adjust their diet, and actively avoid pharmaceuticals. For these individuals, self-prescribing acute remedies like bryonia provides a practical path to recovery, bypassing pharmaceutical dependency. Now consider the pragmatist. This is someone who refuses to alter their sleep schedule or diet and simply needs a fast 20-minute fix so they can get back to their desk. If you fall into the pragmatist category, do not waste your money on homeopathic remedies. They are catalysts that support holistic systems. They are not direct one-to-one replacements for an ibuprofen. There is also the chronic sufferer. If you experience debilitating migraines accompanied by intense nausea, blurry vision, or vomiting, self-care often hits a wall. When self-guided homeopathy fails against severe cases, the trade-off shifts. You need an external perspective. This requires committing to a professional homeopathic consultation. A 2 to 4 month plan involves a qualified practitioner mapping your symptoms, providing a bespoke prescription, and monitoring your body's response over time. However, there is an absolute medical boundary where holistic experimentation must stop immediately. If you experience a sudden, severe headache unlike anything you felt before, or if your chronic headaches progressively worsen over time, you require immediate conventional medical evaluation. You must rule out underlying conditions before attempting natural care. Holistic health requires balancing natural self-care with clinical expertise. You must identify which symptoms respond to a remedy and which demand intervention from a hospital.